Hello, my name is Edna Akora Mofanaya, and I am a nurse practitioner student at Franklin University. In this video, I will be educating my patient about a recently prescribed medication. I will be explaining what blood pressure is, the pharmacokinetics, the pharmacodynamics, contraindications, potential adverse effects, and instructions for taking the medication. So the medication I will be talking about today is Tecturna aliskiren. It is a medication taken by mouth to lower blood pressure. And to understand what blood pressure is, first I will explain where blood pressure comes from. So think of your heart. Blood pressure comes from the heart. Think of your heart as a balloon filled with water. The water is your blood and the balloon is your heart. And the balloon has a mouth that opens and closes automatically each time you press the balloon. And when you press the balloon, the force inside the balloon that makes the water come out is blood pressure. So now, depending on how hard you press the balloon, how hard or soft your balloon is, how narrow or wide the mouth of the balloon is, can affect blood pressure. So this means that anything can affect blood pressure. Anything can make your blood pressure go up or make your blood pressure come down. So in your case, your blood pressure is high and we're trying to lower your blood pressure. The pharmacodynamics of taking Tecturna. So pharmacodynamics basically means how does the drug work and how does it work in my body. Tecturna will lower your blood pressure by lowering the production of renin. Renin comes out of the kidneys. Think of the kidneys as like a machine that monitors how much water comes in and out of your body to stabilize your blood pressure. And it also removes waste, or you can think of it as removing bad or dirty things from your body. Think of renin as your friend that makes sure your blood pressure is always stable. But sometimes renin is unable to maintain your blood pressure and make it stable at all times. Tecturna will lower your blood pressure by reducing the amount of renin in your body. When your body has a stable amount of renin, the mouth of your balloon, which in this case is your heart, relaxes and blood flows easily to the rest of your body and in turn lowers your blood pressure. Pharmacokinetics. So think of pharmacokinetics of Tecturna as how is the medication absorbed in my body and how does the medication that I'm not using, that was not used by my body, how does it leave my body? So Tecturna is poorly absorbed in the body and it has a bioavailability of 2.5% and an accumulation half-life of 24 hours. So think of bioavailability as the amount of drug in your body that actually lowers your blood pressure. And then 24 half-life, the half-life of 24 hours basically means it takes 24 hours for the half of the effects of Tecturna to leave your body. After swallowing Tecturna, the highest amount of the digested and absorbed medication in is seen in your blood in 1 to 3 hours. And about one-fourth of the absorbed dose appears in the urine in its full capacity, meaning one-fourth of the medication that you're going to take will not metabolize. That means it's not going to be broken up and absorbed by your body to lower your blood pressure. And then the amount that is actually metabolized, that's broken down and absorbed by your body to lower your blood pressure, that amount is unknown. We don't know what that amount is. A transport a transporter in the body called PGP was found to be the main source of intestinal absorption of Tecturna. So basically what that means is that most of the absorption that takes place occurs in your large and small intestine in your belly. And Tecturna is removed from the body, the leftovers are removed from the body when the metabolized part goes through the liver into the gallbladder and then it's pooped out. So think of your liver as a washing machine. It cleans out your blood and it sends the dirty parts to the gallbladder. So think of your gallbladder as like a little bag where you store dirty things, and then when you're ready to get rid of it, you poop it out. Some potential adverse effects include its effect on unborn babies. So babies that are still in their mother's womb can have organ problems or can even die from the effects of Tecturna. People can have a bad allergic reaction called anaphylactic reaction, head and neck swelling, which can make it really hard for people to breathe and their brain to swell. And this can cause problems for the brain by not having enough blood go into the brain, and this can cause stroke. Low blood pressure can also be an effect of Tecturna. Some common things that happens is having diarrhea, so that's pooping, watery poop all the time, coughing, feeling dizzy or vertigo. This is when you feel like things are spinning around you or you're spinning around things. Back or joint pain, feeling tired, belly pain, high levels of potassium. You can also have flu like symptoms such as fever, coughing, chills, sweats, body aches, and runny nose. Contraindications. This means you do not take Tecturna if you have any of these issues, such as if you have any allergy to any of the products that's used to make Tecturna, you cannot take Tecturna. Don't take Tecturna if you have high blood sugar, also called diabetes, and if you're taking any medications that has angiotensin receptor blocker ARB or angiotensin converting enzyme ACE or ACE. If you do not know if any of your medication has ACE or ARB, call your primary care provider and they'll be able to tell you what medications you take that has ACE or ARB. Do not give Tecturna to children younger than 2 years of age, and the safety and effectiveness of Tecturna has not been proven or established for children younger than 6 years of age. Do not take Tecturna when pregnant or if you're trying to get pregnant. It can affect the baby or even kill the baby. There isn't much information about the exposure about geriatric patients taking Tecturna. The only thing is that the exposure is increased in elderly patients 65 years and older, and the adjustment of the starting dose is not required. Some instructions: tell your doctor about all your medical conditions and medications you're taking, your allergies. Take Tecturna as instructed by your doctor. If you get any adverse reactions, call your doctor. Let them know, but first make sure you get medical attention as soon as possible and then let your doctor know. Thanks for listening. Bye.